Welcome. I'm Betsy Abramson, the director of the Wisconsin Institute for Healthy Aging. I'm delighted to be talking with you today. This webinar is for potential leaders, registered program providers in Wisconsin, and other partners interested in high-level evidence-based health promotion programs. The Wisconsin Institute for Healthy Aging was formed to advance both the spread of evidence-based prevention programs throughout Wisconsin and the nation, and to encourage and support healthy living through partnerships with public and private organizations. We have a research arm that's hard at work designing, developing, and testing new interventions. And WIHA is also a clearinghouse and support center for many community-based workshops and programs that promote healthy aging and healthy living. As you'll learn from this webinar, WIHA provides many services and tools to support you and your partners in increasing access to these programs in your local communities. Have you ever seen this? It was developed by the University of Wisconsin School of Medicine and Public Health. It shows the 4 factors that are considered the determinants of health: individual health behaviors, clinical care, social and economic factors, and physical environment. Look at it here in this pie chart form. What generally surprises folks most is that clinical care impacts only 20% of your health. The biggest impact on our health comes from those top 2 slices of the pie. Our own individual health behaviors at 30%, and note that that is bigger than clinical care, as are the social and economic factors, which is 40%. Our evidence-based health promotion programs fit squarely in that 30% slice, individuals' own health behaviors. The Wisconsin Institute for Healthy Aging programs help people learn how to better manage their own health through the knowledge they gain and then their own goal setting related to exercise, diet, weight management, medication adherence, socialization, their own home environment, how they interact with their healthcare provider team, and how all that will affect health. What do we mean by evidence-based health promotion programs or prevention programs? These are programs that reduce chronic diseases and falls. It's important to know that many issues adults face are highly preventable, like falls, chronic disease, complication from chronic disease. These programs can really turn the tide. They improve quality of life and health behavior, health and functional status, and overall well-being, as well as confidence in managing your health. And they reduce healthcare costs. These programs also help form community partnerships. Community organizations and healthcare entities can partner to implement evidence-based health promotion programs because making strong community clinical linkages is integral to promoting good health and reducing disease and disability. Let's look at the slide's 4 major points in defining an evidence-based health promotion program. First, it's a proven program that promotes health and prevents disease. Second, it's based on research, science. It's been proven. And at WIHA, we only accept and administer programs that meet the gold standard of research, in that they are tested with a control group and an intervention group, and our scientific evaluators have reviewed the data and concluded that the program works by comparing the results from the 2 groups. Finally, these are packaged programs. They have carefully designed training programs for the leaders, and they are based on a very carefully designed and tested curriculum. Our program leaders learn how to deliver the program and commit to delivering the program with fidelity, just as they are taught, because the only way to guarantee the same good outcomes is to deliver the programs in the exact same way that the program was designed and evaluated. This video is to prepare individuals for the upcoming training to become a leader of this program. We'll start with an overview of the program itself, why it's needed, the proven outcomes, and the workshop's basics. Then we'll talk about the reach this program has had in Wisconsin and the team you're joining. And finally, we'll go over what it means to be a workshop leader, what you can expect from us, and what we hope we can expect from you before, during, and after the training to become a workshop leader. I'll now turn it over to a program expert who will provide the rest of the orientation information. But before I do, I want to take this opportunity on behalf of both WIHA and your local community to thank you for your interest in providing these workshops in your area. Let's go.
Why is stepping on needed? Well, we know that falls are not a normal part of aging and that they are preventable. 1 in 4 adults aged 65 years and older fall every year, and fall-related injuries are also the leading cause of death not only in Wisconsin, but nationally for older persons. And the majority of the falls do occur at home. When we think about a fall, we have to think about the consequences that come with a fall. We know that every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult does die from a fall. Falls do contribute to about 40% of the nursing home admissions, and falls cost $50 billion annually across the nation. And 70% of those costs are covered by Medicare and Medicaid. So when we think about a fall, we have to think about not only the cost that is associated with it, but we also have to think about the emotional toll that it takes on the person that fell, as well as the fear of falling, where they reduce their activity and isolation, which in the end causes and elevates their risk for another fall. And this is how the Stepping On program can help. The program itself was developed in Australia by Dr. Lindy Clemson and her colleague Megan Swan. It was tested and implemented in the community setting, and they did 2-hour sessions 1 time a week for 7 consecutive weeks. They then did some follow-up home visits or phone calls. And then about 2 to 3 months after that 7th session, they did a booster session where they invited the entire group back to do a follow-up. Each group consisted of 10 to 14 participants, and the program itself is led by 2 trained leaders, or a trained leader and a peer leader. The Stepping On program has gone through research and is now shown to be evidence-based. It also meets the Administration on Aging's highest standard, and when developed by Dr. Lindy Clemson and Megan Swan, Dr. Jane Mahoney at UW-Madison was then able to bring it to the United States. And over the years, she was able to develop the program to what we now know it today through pilot testing, refinement, and evaluative research, all to show that it is proven to work effectively when implemented the same way. Through the research, there were proven outcomes to show that the intervention group had a 31% reduction in falls. They also showed that they maintained confidence in more mobile activities of daily living tasks. They also used more protective behaviors. And then also after 14 months, they were still doing their exercises. 70% followed up with home visit recommendations. More subjects had vision checks and less likely to start taking new psychotropic medications. Some of the core principles that are associated with Stepping On includes facilitation to affect behavior change, also decision-making as a process, principles of adult education, self-efficacy as a tool for change, mastery experience as a tool for change, group process, and the preventive framework. Because Stepping On is built to help individuals maintain at home and stay safe, there's a target population that the program has been proven to benefit. You want to look for individuals that are age 60 years and older, that they're at risk for falling, that they have fallen in the past year or have a fear of falling, that they're community dwelling, which means that they live in their own home or apartment, that they're cognitively intact, so then that way they can make changes and apply the tools and the knowledge that they get in the class. They walk independently or with a cane. They can use a walker outside of their home. And then they also must be able to speak and understand conversational English or the language in which the program is being provided in. You'll notice that the Stepping On program is a CDC-approved fall prevention program because of it being multifactorial, which means that it focuses on balance and strengthening exercises, linking them to daily function, as well as advancing the exercises. We also take a look at vision, medication review, and home modification. A few of the other components that play into the multifactorial part is that we do include guest experts as well that include a physical therapist, a vision expert, a medication expert, and a community safety expert. The Stepping On program has topics that include building trust and risk appraisal, balance and strengthening exercise and the home practice that's associated with that, home hazards and safety modifications, community safety, bone health, medication management, sleep medication alternatives, safe footwear and safe clothing, and vision and falls. The guest experts that I had mentioned in the previous slide do cover some of these topics. If we take a little closer look at the Stepping On program week by week, you'll see in session 1 we cover introductions, overview, and then also getting input from the participants as to what additional topics they would like to see being covered. In session 2, we go through the exercises and moving about safely. In session 3, we advance the exercises and discuss home hazards. In session 4, we have vision and falls, community safety, and footwear. Session 5, we have medication management, bone health, and sleeping better. And session 6 is getting out and about safely, where this is a physical therapist comes and does one-on-one approach with the participants to then navigate out into the community, whether it's going up and down a curb, utilizing stairs, or going on uneven ground. And then finally in session 7, we review and plan ahead. We discuss long-term goals that we focus on that we will then later cover in the booster session. The dissemination work began in 2006 in the state of Wisconsin when Dr. Jane Mahoney and in partnership with Kenosha County had brought the program over to the United States. The program has been disseminated in a range of agencies that provided the workshop as well as a variety of host sites. We also had a range of professionals and peers who served as the leaders. In 2010 is when the Stepping On program went outside of the Wisconsin walls and began to grow nationwide. Today in 2018, currently at 22 states and 36 individual license holders. During the Stepping On Leader training, it is expected that you come in pairs or alone if your agency or organization already has an active Stepping On leader. It is 3 full days. The days usually begin at 8 a.m. and end around 4:30 to 5 p.m. in the evenings. It is expected that you attend all 3 days to be certified as a leader. During the 3 days, you'll learn how evidence-based for falls prevention is important and how Stepping On covers that. You will also know that the underpinning concepts of Stepping On and what those entail. You will also learn the curriculum of Stepping On. Your master trainers will be modeling most of the activities in which you will then be providing for your participants. Through that process, you'll begin to learn some group facilitation skills and techniques, including practice. And then you'll also find out on the last day about marketing, recruitment, and partner strategies. You also learn that WIHA has protocols and support available to you via the web as well as live people. And then during your first workshop, you will have a fidelity coaching session. This is an opportunity for you to learn and grow as a leader, as well as for us to better the program as the years come. To see if you fit as a Stepping On leader, please consider the following. We're looking for individuals interested in helping others. We're also looking for individuals who can speak comfortably in front of a small group and can commit to attending a 3 full-day in-person training. Once a certified leader, you'll need to block out about 4 hours a week to conduct your 7-week series. This includes travel to and from your workshop, setup time, conducting your workshop session, and packing things up. Some additional time during the week may be needed to set aside to prepare for upcoming sessions and to follow up with participants. There's no messing with perfection, meaning that the information and the way it is to be delivered is already set for you. In the training, we'll teach you facilitation techniques, model skills to prepare you to lead a workshop with another certified leader or peer leader. You will help others learn how to take small steps towards permanent, positive changes and healthier living. You will be building people's confidence in the ability that they know they can prevent falls. People who are past participants of a workshop are strongly encouraged to become peer leaders, as they've seen the impact of these programs firsthand. The leader expectations for Stepping On is again to attend the entire 3 full-day in-person training, to work with a local program provider and partners, lead workshops in pairs, both trained or one trained leader and one peer leader, lead at least 2 workshops during each year, follow your leader manual, secure and distribute ankle weights to workshop participants, prepare and use the stepping on display, copy and distribute exercise manual and handouts at appropriate times, invite, prepare, and host 4 guest experts, and follow WIHA administration protocols. During the training to become a workshop leader, you will receive a leader's manual that has all of the instructions and script when leading your first workshop in your community. You will receive a leader manual, a leader toolkit, access to online resources, and your first pair of ankle weights that are required to lead a workshop. The display will be covered in the training, but it is a display of items that relate to preventing falls. There are 4 guest experts, a physical therapist, a vision expert, community safety expert, and a medication expert, along with a past participant. Ankle weights, handouts, and exercise manuals are required for all participants to use during the course of the 7-week workshop series. Your local area is in charge of supplying these items. You will learn ways to cover these items through your agency and partners. All of these topics will be addressed in more detail at the training to better prepare you. Other materials needed are blank flip chart pads, tape, and markers. Access to a projector and DVD player, and offering healthy snacks to participants is also a requirement of the Stepping On program. The booster session is the last component of your successful workshop. In some communities, this is labeled as the 8th session. It is very much a requirement of the program, and it is usually held about 2 to 3 months after the 7th session. This session allows for participants to learn about successes, challenges, and to remotivate them, getting them back on track with their exercises. Jill will be coming on next, and she'll be talking through the planning guide tailored to the Stepping On program, as well as program providers. I look forward to seeing you in the next leader training. Now back to Jill.
Hi everyone, my name is Jill Rankin and I work for WIHA as the Director of Program Provider Partnerships. I've been working with the self-management programs for 12 years now, and my role is to work with organizations at a leadership level in implementing the program in their communities. We here at WIHA do believe that organizational support is essential for program leaders to be successful in implementing the workshops, which is why my position is dedicated to organizational support. Another step in preparation for your training to become a workshop leader is working with your program provider organization and area partners to be sure that your workshops are a success. So to do so, WIHA has created a planning guide for you to fill out, making sure that you're covering all the steps and are planning ahead. But fear not, you are not alone. Michelle is going to be joining us later in the webinar to talk a little bit more about the great support team you have backing you up. But it's also good to know the tools. You can find the planning guide at the link provided on the Leader Training Schedule website page or at the beginning of the Leader Training application. In order to complete the planning guide, you'll want to start with 2 important steps. Number 1, to identify your program provider organization, which we're going to talk about in a minute. And then number 2, if there are other local program providers, be sure to make contact with them in an effort of collaboration. So in order to provide organizational support to our program leaders, we have a process that will engage local leadership through the program provider registration. So what are program providers? They are organizations that deliver one or more of the WIHA evidence-based healthy aging programs in their community. They employ program leaders or support volunteer program leaders. This does look different in every area. There might be multiple organizations working together to deliver the program, therefore multiple program providers in the area. So who is your program provider? If your employer is paying your time in facilitating the workshops, then they are your program provider organization. If you are a volunteer doing it unpaid, your program provider is the organization for which you are facilitating the workshops for. And then if you're on your own completely, we ask that you please contact us here at WIHA. We will either assist you in determining who your local organization is that could be your program provider, or if that still doesn't apply, WIHA can be your program provider organization. Then how to register. It's a simple 1-page form that's online. You'll contact myself, Jill Rankin, and it will include just simple things like your organization contact name and information, the WIHA programs that are administered in that organization, and the geographic area served. All registered program providers do receive dedicated organizational support from WIHA. So as previously overviewed, you and your registered program provider organization and possibly other partners in your area will be filling out the planning guide together. So as you work with your program provider organizations, you will plan the following in order to prepare for your success. First, you are going to select the dates and the times for your first workshop. We do find that people who come to the training with their first workshop already in mind and planned are able to take in and apply the information learned from the training and then implement it right away once they're back home. The sooner you lead, the fresher your skills are going to be and the less intimidating it will feel. Then you'll decide whether the workshop will be for free or for a fee and then how much. You'll select and reserve a venue with appropriate room arrangements, and our planning guide will go into further detail around what those requirements and recommendations are. You'll decide who's going to submit your workshop notification form to WIHA. That will be worked out with your supporting registered program provider organization. And then what agency will receive the workshop registration. It should be somebody who can speak about the program and help people with any questions that they have related to the program. So as you can see, there's a handful of considerations to discuss with your program provider organizations. When your workshop is scheduled, the next step is outreach and marketing. And WIHA's website does have lots of marketing templates already made for you to download and customize. Then you will want to figure out where and to who this outreach is going to be happening. Track what works best in your area. We are striving to register at least 18 people per workshop. We also do have data collection for this program, which you'll learn about in the training or directly after the training. You may also need to talk with your area about ways to fund and sustain the program. The materials are low cost, but a cost is a cost, so it's good to have this conversation early. So I'm going to sign off and give the next slide over to Michelle, and she'll talk a little bit more about leader support.
Hi, I'm Michelle Camo, the Director of Leader Development at WIHA. Over the last 10 years, I've been a leader, a trainer, and a coordinator of these programs, and I'm thrilled that you're considering being part of such an impactful program. Now, I know you just received a lot of information, and let me reassure you, it's all in an effort to see the bigger picture of these amazing programs. Further, we want you and your community to feel ready for the training and ready to begin workshops. The last few slides will overview the support that's there for you as a leader, because the training is only part of the support that we give. So after the training, there is a post-leader training meeting, and that's held over the phone, and they happen about 6 to 8 weeks after your training. And this is a check-in rather than a check-up. We'll review a few WIHA-related items, but mostly it's there to hear from you and your fellow trainees about how things have been going since the last day of your training. We also have a leader section on our website where you can find all the great resources, current handouts, and whatever else is needed to plan, organize, and prepare you for your workshop, start to finish. We also have a leader listserv. So after the training, your preferred email address will be added to this leader listserv or discussion board, and it's a group made up of all the active leaders around the state in this program. It's a way to share, discuss, and get events or other important program updates from WIHA. We have technical assistance because technical assistance is really important for the success of this program. No leader should be flying solo. So building a local network of partnered program providers will not only be great support to you, but it also ensures the program success and in turn improves the health of your community. The more people that hear about it and learn about this low-cost, effective community wellness workshop, the better. If you don't know who your local program provider point person is, please contact myself or Jill Rankin. So WIHA staff are also available to help you with any questions. If you're confused about the curriculum or need advice about a certain situation, we're here to help. There's no wrong door. And if we don't have the answer, we'll definitely find somebody who does. But this office is a wealth of knowledge and has some really wonderful resources at our fingertips. all of our leaders and coordinators around the state. So periodically, we'll be offering webinars about this program, and the topics may be about best practices or highlighting a local area about their bright idea or showcasing a new concept to try. Announcements about these offerings will be made on that leader listserv. So we want you to know how much we value your commitment and that we're here to help. I hope you're feeling prepared and excited. All right, so are you ready to become a leader of these workshops? Your first step is to complete the leader application found on our website to save your place at the leader training because space is limited. You're going to need to commit to the requirements outlined in that application, and you'll be sent a copy of these requirements with your application confirmation. There is a cost to the training, and you can pay that by credit card during the application process or select the invoice option, and invoices are sent after the training concludes. As Jill discussed, you're going to need to fill out that planning guide with your registered program provider in preparation for conducting your first workshop. And lastly, keep eyes out on your email. We'll send a confirmation that we've received your application. Then, once reviewed by staff, you'll receive an approval email confirming your place in the training and outlining all the logistics and the details around the training, like the time, the location, any pre-homework or expectations. And then lastly, you'll receive a reminder email closer to your scheduled training. Thank you for your attention today. If you have any questions or concerns, contact us. We gave a lot of information, and it's better to ask than be unpleasantly surprised later. A secondary big thank you is for being interested in this impactful work. These programs are valuable medicine for your community. Your success betters their health and their well-being, and we couldn't do it without you. So get those applications in, and we'll see you at training.